In 2015, AllCare Health helped to pilot a project in the Phoenix Talent School District called the Good Behavior Game. The concept is simple. In a classic classroom setting, kids who act out get the attention of the teacher and other students. The game provides teachers and students with ways to not focus their attention on the child who is acting out. As time goes on, all the kids look for attention in other, more positive ways. The game is great, but the numbers are even more impressive. In fact, off-task behaviors in the classroom dropped on average over 67%. Referrals to the principal's office dropped by nearly 50%, and days lost due to sickness decreased by approximately 25%. Teachers expressed more enjoyment in teaching, and happy teachers save school districts money by staying in their jobs. And without the disruptions, kids can get an additional month of learning time over the course of a school year. It was so successful in the Phoenix Talent School District that in just over 2 years, the Good Behavior Game spread throughout the entire Rogue Valley. Today, over 500 teachers have been trained, which means that more than 12,000 students can experience the Good Behavior Game in their own classrooms. These results are very exciting, and while studies do show that educated kids tend to be healthier, what is it that really makes a healthcare company want to support a school program like this? Simply that the Good Behavior Game is an evidence-based program that's been tested throughout the nation and has proven positive results. By looking at the data for the Rogue Valley, this is what we can expect from kids who have had 1 or more years of exposure to the Good Behavior Game classroom. 1,032 fewer young people will need any form of special education services. 668 more boys and 1,065 more girls will likely graduate from high school. 802 more boys and 832 more girls will likely enter university. 117 fewer young people will commit or be convicted of serious violent crimes. 1,154 fewer young people will likely develop serious drug addictions. 789 fewer young people will likely become regular smokers. 425 fewer young people will likely develop serious alcohol addictions. 582 fewer young women and 789 fewer young men will likely contemplate or attempt suicide. What does this mean financially for the Southern Oregon region? An estimated savings of $150 million a year by the time the children reach age 21. Aside from all the other positive benefits, the impact on mental health and addiction reduction makes this a critical investment for the health of our communities. The long-term impact kids felt from learning self-discipline will have positive ramifications for generations. This is changing healthcare to work for everyone, but it can only happen with local involvement, guidance, and coordination.